Hi everyone, I'm Dr. Kim Shepard with Align Family Wellness. We're back for week 3 of why our office is different. Today we are going to be talking about our InSight scans. This is something that is new to our area. We are the only ones using this technology. It has been amazing. We've been using it for the last year in our office, and it has been such a game changer for our patients. And so I wanted to talk to you today about why we use it, how we use it, and what they look like. If you want more information, our Facebook and our Instagram feed have lots of carousel posts that kind of walk through and show you each one of the instruments and what they do, but I wanted to talk to you about them specifically today. So basically, we're going to break it down real simple. There are 3 things we are looking for when we are doing these InSight scans. We're looking for, do you or your child have stuck stress in your spine? That's number 1. Number 2, how much stress? And 3, where is the stuck stress at? So we all have stress. We know that, but we need to know how the stress is affecting our body, how much it's affecting our body, and what that's doing to our nervous system and what it's doing to our immunity levels. So one of the things we do 3 scans when you come into the office. So if you are a child, anywhere between 5 and under, you only get 2 scans because we know kids are a little wiggly and they're a little bit hard to sit still for one of our scans. But every new patient will get these scans, and anyone that hasn't been in our office in the last 6 months, you'll get a scan when you come in too. Another amazing thing is those of you who have joined our new wellness plans, you get a free scan as part of our wellness plans. So we are super excited to offer that to you. So if you are curious and you are on one of our wellness plans, we would be happy to scan you and give you your score. So what we do is first you get your heart rate variability. So that test is called the neuro pulse. And what we do is we use heart rate, temperature, and skin conductance to calculate your HRV, which is your heart rate variability. And that tells us how adaptive your body is to stress. Not that we don't have stress, it's how adaptive your body is to stress. And we will get a score from 0 to 100, and we kind of have some zones in there that tell us, how much your immune system is being affected by this stress. So, coming off of a few years of COVID, we are seeing more stress than ever, especially in our kiddos and our newborns. And so, a lot of our kiddos can't tell us they're stressed. So this heart rate variability test is amazing because it will actually tell us what the kiddos can't tell us. For adults, we know we're stressed, but now we can see how much stress we have. And then we can check it again and make sure that as we're adjusting you and affecting your nervous system, we are affecting your heart rate variability. So that's the first test you get. All of our tests have no emissions. They have, they're safe for babies, they're safe for adults, and you're just gonna put your hand in a little machine for that one. So number 2 is your neurocore. I always have to get these specific names correct, so I'm looking at my notes. Neurocore, which is a surface EMG. So basically what that does is it collects neurological data from the muscles along the spine, and it tracks if you're within or without, or not within normal ranges. So it tells us how much postural stress you have and how much it's affecting your spine and overall energy. So we get this postural energy score that tells us you're using too much energy just to function every day and stand upright, or maybe there's certain areas that don't have enough energy that we need to put some neurological input in. So that is called the neurocore or the surface EMG. And most of our kiddos don't get that test because you do have to sit a little bit more still to get the reading. So we let our kiddos skip out on that one. So the third test is a actual thermography scan. So it is called a neurothermal scan. So it detects imbalances in the spinal nerves and how they affect your organs. So we're recording temperature in the spine. We kind of start at the base of the spine, right around your sacrum, and then we compare that temperature as we move our way up along the spine, and we get different temperature readings. So what we use that information for is mostly like our colicky, our reflexy babies. We are able to tie those segments of the spine to different areas that are causing issues within the baby. Adults, we can tie that back to stress, anxiety, maybe some thyroid issues. So, when we go over your scores, we can actually tie that back to specific areas of your spine that are affecting your organs based on your temperature balance. So all 3 tests combined, we get a core score. This is once again 0 out of 100. So we kind of grade it in our office from an A to an F. So we give you either an A, B, C, D, or an F on your score. All lighthearted, but what we want to do is recheck those and make sure that your grades are coming up and you're doing better and the adjustments are working. And this is so great to track because not only will you feel better with your adjustments, but we can see it in your core score, and your core score improves. And that way we know that you are neurologically healthy and you're not so dysregulated, and we know that we're improving your immune system. So that's your stress adaptation score. So we want it to be as close to 100% as possible. And so we evaluate this on every new patient, anyone that comes back into care, or like I said, if you're a wellness patient and you're interested, we would be happy to do that. But we're measuring if you have stress in your spine, where it's at, and how much. So just to break it down simply, these are really, really simple tests. Anybody can do them. They take about 15 minutes max, and they give us so much information. And the reason we need that information is because we care plan in our office. So we will go over your scores with you, but we will also sit down and make a treatment plan based on your neurologic scans. And what that means is we set forth a treatment plan. It's not just a, hey, we'll adjust you once and see how you do. We are confident in our treatment plans, and we can tell you exactly what your score is based on, how much treatment you are going to need. And we always have checkpoints along the way. We will always rescan. We will always change if we need to. We can cut you back on visits or add visits. And then when your scores look amazing, then we can get you on wellness care and just have you continue to thrive and do well. So if you are interested in getting scanned, if you have more questions, you can always message us on Facebook or Instagram. Please give our office a call. We would love to connect with you. We would love to see you as a new patient and get you scanned and get you ready for treatment. So thanks for listening.